Welcome to the MVHIN to Hospital Improvement Innovation Network conference call. My name is Katie, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we'll conduct a question-and-answer session. Please note that this conference is being recorded. I will now turn the call over to Deb Smith. Please go ahead.
Thank you, Katie, and good morning to everyone on the call. Welcome to the HQI Maryland, Virginia HAI Improvement Network, or MVHIN to HIIN webinar. So I just have a few announcements before we start. Anyone on the phone who is not logged in yet to the webinar, please use our new HQI lowercase as the password. We're very sorry that it got sent out as VHQC. This webinar is being recorded and will be available on the HQI online community within a few weeks. The handouts for the webinar will be emailed to you at the conclusion of the webinar. All your lines are muted. There'll be time for questions. At the end of the presentation, we'll open up the lines. But during the webinar, please use the chat box at the right-hand side of the screen for any questions that you have. So in case you haven't seen any or gotten any of our communications, our name has changed. So here it is. We're now Health Quality Innovators, or HQI. We are still the same organization, however. VHQC has been in operation for more than 30 years, so we thought it was about time for a change that reflects our expanding role in the world of healthcare quality improvement. HQI is truly innovative and progressive when it comes to working with healthcare facilities across the continuum to provide quality healthcare. And as you can see, with our name change, also comes a change in our email addresses and our website. So you can go to www.hqi.solutions to check out our new look. And as you all know, too, it's also changed the password for our webinars to HQI. We're also the same team of healthcare professionals who've been working with you over the past 2 years. Myself, Katie, and Eileen are all improvement consultants working on various quality improvement projects that you'll hear about later in the presentation. Jennifer is our awesome HQI analyst who pulls your NHSN data and makes it pretty every month, along with a multitude of other analytical tasks for HQI. Rhonda Fletcher is our project assistant who has her hands full keeping us all on track. And finally, Sandy, the improvement consultant who leads the inpatient quality reporting work at HQI. Sandy's also agreed to manage the chat for today's webinar, so feel free to ask questions. She will be there to answer them or field them, or just get into chat and say hi to Sandy. I really do feel like we're just starting to make good progress with the MVHIN. We've gotten through the growing pains of submitting timely NHSN data, signing up for Box to view our data, using the online community for tools and resources, and some of you have completed the Targeted Assessment for Prevention, or TAP, baseline assessment for CDEF, CLADI, and CLADSI. We'd like to use this time today to see where we've been and show you how you can continue to sustain that gain by working with us through the Hospital Improvement Innovation Network, or HIIN. But first, let me introduce and turn the program over to our HQI analyst, Jennifer Chang. Thank you, Jennifer, for being on the webinar today and presenting our data.
Thanks, Deb. So this will just be a quick review of our overall progress as a network by state and unit type for each of our targeted HAIs. So on each graph, data starts at the beginning of 2014 and goes up through the most recent quarter we had complete data for the network for, which was quarter 2 of 2016. We also indicated on each graph, can you go back, Deb? We also indicated the start of recruitment on each graph, so August 2014, and the end of recruitment, July 2015. So the first one up on your screen here is Maryland CLADSI, and you can see the spike at the start of 2015 that we had all talked about when it happened because the definitions for CLADI and CLADSI had changed. This is probably the area that we struggled with the most. Here you can see that Maryland has its aggregate ICU and non-ICU units ending at 0.76 and 0.88 respectively, compared with the national benchmark of 0.50. Next slide, please. In Virginia, again, we see that same uptick at the start of 2015, but by the start of 2016, the SIRs had started to really come down. So both ending below the benchmark at 0.43 and 0.39 for ICU units and non-ICU units, respectively. So that's some really great improvement. Next slide, please. For CAUTI SIR, as you all know, both states are doing fantastic. You can see here in Maryland that the SIRs fell far below the benchmark in early 2015 and sustained SIRs hovering around 0.5 for both unit types compared to the national benchmark of 1.0. So more specifically, the ICU units fell from 1.58 at the start of recruitment there down to 0.79, and the non-ICU units dropped from 0.88 to 0.41. Next slide, please. In Virginia, it's a similar story, although with a slightly larger gap between the unit types. So here, the state of Virginia ends at 0.67 and 0.42 for ICU and non-ICU, respectively. And it's clear that the ICU units, that light purple, had a particularly noticeable downward trend from a very high SIR start. So it dropped from 1.45 at the start of recruitment to 0.67 by the end. So great job to all of you for making such impressive strides in CAUTI. Next slide, please. Our next measure was also for CAUTI, and it's defined as the percent of units at or below the device utilization ratio, or DUR mean, for their unit type. So the goal here is to reach around 80%, or at least 80% of units at or below the DUR mean for our contract goal. And we also had an intermediate goal for July 2016 of reaching 60%. So in Maryland here, our non-ICU units definitely met the July 2016 goal by the end of quarter 2 2016 and came really close to meeting the contract, coming in at 77%. The ICU units struggled a bit more. They seem to hover around 50% for the last year or so. Next slide, please. In Virginia, both unit types didn't reach the 60%, but you can kind of see that non-ICU units really seem to be trending upwards since the end of recruitment there. So hopefully that trend will continue. Next slide, please. For CDS, this was a facility-wide measure, and you can really see quite clearly that Maryland was steadily making improvements all the while. They dropped from 1.25 at the start of recruitment down to 0.93 by the end of quarter 2 2016, which is just 0.01 away from reaching that national benchmark of 0.92. But again, we have these intermediate goals that we set, and for CDI in July 2016, that goal was 1.2. So actually, Maryland easily met that goal a while back, as you can tell on that graph. Next slide, please. For Virginia, progress is a little more variable up until the end of recruitment, where you can see that the SIR then fell from 1.02 down to 0.80 by the end of quarter 2 2016. So here, Virginia definitely met that national benchmark of 0.92. So really excellent work from all of our hospitals. It's clear from the data that everyone has been pushing hard to reduce infections on all levels, and we'll continue to improve where needed. I also wanted to note that we do have the data from these slides available with additionally the specific numbers from each graph and tables in a PDF report format. So if anyone would like to receive that, please just let us know, contact us via email or otherwise, so you can kind of look through this more slowly and carefully on your own. Please just let us know, and we'll make sure to get it to you. And if anyone has any questions on the data, we will have a Q&A session at the end of the call. So thank you, and next we'll be hearing from Eileen on the big upcoming changes on our MVHIN network.
Thanks, Jennifer. The Maryland and Virginia HII Improvement Network is moving, and we want you all to move with us to the new network. Next slide, please. The work of both MVHIN and the Hospital Engagement Network, or HIIN, are now merged together into the new Hospital Improvement Innovation Network, or HIIN, which we want you all to join. You can go to the next slide. So what is a HIIN? As I mentioned, this stands for Hospital Improvement and Innovation Network. There are 16 HIINs covering the nation. It was formerly known as the Partnership for Patients Hospital Engagement Network, or HIIN. The HIIN is a national team set up to accelerate safer care in the U.S. and is funded by CMS. The goals of the HIIN are ambitious: to reduce all-cause inpatient harm by 20% and readmissions by 12% within 2 years, with the possibility of an optional third year. HIINs will align and amplify the QIN, QIO, and HIIN work from the last 4 years, with a focus on reducing HAIs and HACs and decreasing avoidable readmissions. There are 2 HIINs that will be available in Maryland and Virginia. They're HRET and Premier. You can go to the next slide. So Premier is a healthcare improvement company with approximately 3,750 hospitals and 130,000 other providers in their collaborative, and their mission is to improve the health of communities. HRET, which stands for Health Research and Educational Trust, is a nonprofit research and education affiliate of the American Hospital Association. Their mission is to transform healthcare through research and education. Hospitals can choose one of these HIINs to join, but both will provide the same goals. Both will engage partners to improve quality of care by implementing best practices. Hospitals will have access to learning collaboratives to help implement changes and innovations to achieve safety and care transition goals. Next slide. So what will the HIINs be focusing on for this initiative? The HIINs will have both core and additional topic areas. Core areas include many HAIs that you are already working on, including CLADI, CLABSI, C. diff, SSI, and VAE. Additional core targets are adverse drug events, injuries from falls and immobility, pressure ulcers, readmissions, sepsis and septic shock, and VTE. Additional HIIN topics are on the right. I won't go through them all, but I did want to highlight the focus on multi-drug resistant organisms and promoting antimicrobial stewardship, as well as improving the culture of safety in hospitals. You can go to the next slide. And now I'll turn it over to Katie for the FAQs.
Thank you, Eileen. So now I'm going to go over the frequently asked questions before you ask them. Next slide, please. First question, which HIIN should you join? Well, that is completely up to you. We just want to strongly encourage you to join one. We are excited that we can continue our relationship with you and that HQI will continue to support HAI improvement activities with those facilities that choose to participate in a HIIN. Next slide, please. Okay, I've already joined MVHIN. Do I have to sign another participation agreement? Unfortunately, yes. The previous letter of participation was specific to that contract, and now you'll have to sign a new letter of commitment to the HIIN of your choice. Next slide, please. When does all of this start? Well, it already started. The work began September 28th with recruitment and will continue for 2 years through September 27th, 2018, with a good possibility of having the contract renewed for a third year, ending on September 28th, 2019, or September 27th, 2019. Next slide. What is HQI's role in all this? As I previously said, we are pleased to let you know that HQI can continue to support your hospital's HAI improvement activities if you choose to participate in the HIIN. This is because HQI will be working as a subcontractor with both HRET and Premier. Now here's where it gets a little bit confusing. HRET and Premier each have active HIINs in both Maryland and Virginia. However, while HQI is a partner with HRET in Maryland, we are also a partner with Premier in Maryland, Virginia, West Virginia, and D.C. The HRET HIIN members in Virginia will not be working with HQI and will instead be working through the Virginia Hospital and Healthcare Association, which is one of HQI's stakeholders. Next slide. What is the cost to my facility? $0. These quality improvement projects are completely funded by CMS to support you. So you've got nothing to lose by joining, right? Next slide. So what do you get out of all this? Technical assistance and coaching from subject matter experts, resources targeting the HIIN topic areas, including checklists, change packages, and case studies, networking with peers, best practice hospital stories on successes and lessons learned, and what I've heard is the most useful from other MVHIN participants is the aggregated data for benchmarking to member facilities, with the added advantage to now having access to data across the HIIN network of hundreds to thousands of other facilities. Next slide. What's happening to Deb and Katie? We're not going anywhere. In fact, the best part about this move is that we'll still get to work with you when you join a HIIN. But because we can't be 3 places at once, we're hiring new team members to help with the HIIN work. Eileen Witherspoon, whom you just met earlier, will be working with those hospitals joining the HRET HIIN in Maryland, and we are in the final stages of bringing other team members on board to work with the premier HIIN providers. Deb and I will still be available to answer questions and provide any assistance during the transition, while also focusing on our other new project, which is outpatient antibiotic stewardship, and Deb will be discussing that project shortly. Next slide. Will there be a new NHSN group to join? Yes, but let's face it, joining a group to confer rights is a lot easier than having to enter data into a whole new system. Once you join a HIIN, you will receive instructions on joining their specific NHSN groups. However, I also want to note that we still have Sandy Gaskins on board doing quality reporting at HQI. So, if you still want to receive the monthly HAI data reports from HQI through Box, the same way you always have, make sure you stay active with the MVHIN NHSN group too. Note that these will be your facility-specific HAI data reports, and if you want to see the aggregated data for benchmarking, that will be an activity through the HIIN. Next slide, please. Okay, I'm sold. What are the next steps? First, and most importantly, make sure your CEO and quality lead co-sign the letter of commitment for the project. Hospitals in Virginia may already have been approached by Premier or HRET with recruitment materials. In Maryland, some hospitals also may have already been approached by Premier. Additionally, HQI will be reaching out to Maryland hospitals on behalf of HRET in the next week or so with recruitment materials, which will include the letter of commitment to sign. So, in short, your hospital leadership should be personally receiving the letters. If you are not sure of your hospital status, feel free to reach out to any of us using the contact information at the end of this presentation, and we can make sure your hospital receives an invitation to join. Next, reap the benefits of membership. Submit your data to the group to document your hospital's progress in improving quality and patient safety. Engage with subject matter experts and share best practices and lessons learned with peers. Prepare for and participate in site visits to help us learn about the barriers and other issues affecting your hospital so that you can help us to help you. And use the HIIN's resources to improve patient safety and support changes within your facility. Next slide, please. And now for the interactive portion of today's webinar. To see who's still awake and paying attention, we have a polling question, which we will leave open for 20 seconds to collect your responses. Emily, will you please open the polling question? I'm going to read the question out loud while we wait for responses because, let's face it, 20 seconds is excruciatingly long while you're sitting in dead air on a webinar. So what's your hospital's HIIN status? Are you A, already working with a HIIN, B, plan to join a HIIN, or C, undecided at this time? And look, there's 20 seconds. Thank you to everyone for responding. Next slide. And now I'm going to turn it back over to Deb to discuss some hot topics.
Well, thank you, everyone. I hope everyone on the webinar today has been paying attention and can tell us all about what a HIIN is now. It's a little confusing for us, so if it's confusing for you, we appreciate any questions that you have, and we're happy to answer them. I was going to review the polling question. I don't see it yet, but okay, so here the polling question just came up. So what is your hospital's HIIN or HIIN status? 3 of 40 people have answered that they're already working with the HIIN, so that's awesome. 7 out of 40 have answered that they plan to work with a HIIN. Another 7 are undecided at this time, and 23 didn't answer. So you'll have time at the end when we put up our evaluation. There'll also be a question like this on the evaluation to make sure everybody's answering it. So yes, while we're moving to the HIIN work for HAIs and other areas of harm in acute care hospitals, we're also now moving beyond the hospital walls to the outpatient settings, and we're beginning work to introduce or improve if they already have an antibiotic stewardship in place. We'll be working with communities to educate patients and families about antibiotic stewardship so they can in turn push that up to their providers and begin that talk about antibiotics when they're prescribed with their prescribers to make sure that they understand why or why not they're getting a prescription. We'll also be working with the community physician practices, ambulatory surgery centers, pharmacy clinics, and emergency rooms to spread education and best practices for prescribing antibiotics. Katie Richards will be leading this work in Maryland, and I'll be leading this work in Virginia. We're both really excited about this. And we're moving to the long-term care community to continue a Maryland Special Innovation Project to reduce sepsis in long-term care. The Maryland Patient Safety Center has been working with the acute care hospitals to reduce sepsis mortality and admissions. The Maryland HQI sepsis project is in its 2nd year and showing success in assisting Maryland nursing homes with tools and resources for early identification and treatment of sepsis in order to reduce sepsis mortality and admissions. The Virginia Stopping Sepsis in Virginia Hospitals and Nursing Homes project is just getting started, so we're in the recruitment phase of this work. HQI is recruiting and will be working with the Virginia nursing homes, while VHHA, the Virginia Hospital and Healthcare Association, is partnering with us on this work to recruit and work with the acute care hospitals. Tools like this one that was developed by the Maryland Stopping Sepsis Project will be shared on the HQI online communities, and those facilities that are signing up for the work get a sign-on packet that includes hard copies. And these are really nice. They're pocket cards and brochures and really nice things that you can be using. So speaking of the online community, here's the link. If you haven't joined it already, it's not too late, so please take a minute, join it, browse through the different task areas, because as you can see, it isn't just hospitals. See different nursing homes, cardiac care, there's care transitions. There's a lot of different tasks on here, and you can look through their task areas and see what kind of tools and resources are on there that would be valuable for your work. So here's our new emails for all of us. Don't hesitate to reach out to us with questions. Eileen can field specific questions about joining the HIIN. Sandy Gaskins is out there to answer all your questions about quality reporting. Jennifer's happy to answer data questions, and Katie and I are there to answer all other questions. Also, we've noticed that we are getting some kickbacks with our emails. So please add HQI.solutions to your safe senders list, so we'll no longer be on the black list, we'll be on the white list. You may have to work with your IT department to make sure that we are that you are receiving our emails. So this is your part of the webinar today. I'd like to ask Katie, the operator, if you would please let us know how we can ask questions on the line.
Thank you. We will now begin the question and answer session. If you have a question, please press star then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then 1 on your touch-tone phone. And we're standing by for questions.
And so now, Sandy, are there any questions in chat?
First of all, can I confirm that you hear me, Deb? I'm having trouble with my headset.
Yes.
Okay, great. I just have one that's outstanding, and you may not know this. It's from Bob. Does Premier have any plans to create quality advisor reports that can make data submission easier for organizations? I don't know if you know Premier's plans.
Not at this point, but that is a good thing to take to Premier.
Okay.
We'll actually be speaking with them next week at a conference, so I'll take that question to them.
And Betsy Betsy also has a question with regard to the SSIs. The surgical site infections are included in the scope of work. Which SSIs?
I'm going to ask Eileen if she knows the specific SSIs that are included in HRET's work.
Yeah, this is Eileen. The HRET is including colon, surgeries, abdominal hysterectomy, total hip, and total knee.
This is Katie. I would imagine it's the same for Premier because they have the same topic areas.
Yes, we'll confirm that also, Betsy. So, yes. Katie, do you have any people in queue waiting to ask questions?
We have no questions in the queue.
So this is your time. We did try to answer all of what we thought would be the frequently asked questions about joining the HIINs. But we would like to hear from you for any other specific questions that you have right now. And Emily from WebEx, is the evaluation posted yet? There we go. All right. Anything else in chat, Sandy?
Sorry, that was it.
So I just saw from...
I'm not sure what...
So from...
Avi Gadala, I'm not sure I understand what she's asking. Should we revoke VHQC access? Is she referencing the NHSN, conferred in NHSN? If they want to continue to receive box reports, they're going to need to continue to participate in that group.
And for any of you that, because I know most of the MVHIN network did sign up for Box, it's a really convenient way for you to get your monthly reports. And everyone who's in it really likes it. If you haven't signed up for Box yet, you still can. So we can still give you access. All of your reports that we've done for MVHIN are in Box. So please, if you're either email Katie or myself, Deb Smith, and we can send you out the invite for Box. The unfortunate thing about the Box invites is that they do expire within 2 weeks. So you may have gotten the invite a month or so ago, or you may have gotten the invite 6 months ago, but that invite is not going to be valid. So we're going to have to send you a new one, and we're happy to do it, and it's a really quick process. You can add other people in your organization, so you can add your leadership and your quality people so that they all have access to that data. So get a hold of us. We can work with you to get you on Box, and those that are already using it and like the reports, they're going to continue. So you do need to stay with that group. Did that answer your question, Avi? Okay, so anything else from anyone? Katie, I'm going to check one more time. Any questions in the queue?
We still have no questions in the queue.
All right. Well, we must have done a great job of explaining this today. Thank you, everyone. You're going to get 20 minutes back in your day, which I know we're really happy about, and I'm sure you are too. Before you sign off for this webinar, please complete the evaluation. And otherwise, happy Friday and have a really wonderful weekend. Thank you.
Thank you.
Thank you, ladies and gentlemen. This is today's conference. Thank you for participating, and you may now disconnect.